Today we are going to discuss the cardiac cycle. In the previous lecture already I discussed regarding the heart valves and also the functions of pulmonary vein and pulmonary artery. And in this lecture, in the cardiac cycle part, I will divide my lecture into 3 parts. In the first part, I will discuss the events involved in one cardiac cycle, and in the next part I will discuss the stimulation, electric stimulation, how it is generated, and the third part I will combine both. That means how these events occur in respect to this stimulation. Okay, and first I'll start with the events. So what is cardiac cycle? Cardiac cycle means the events occur in a single heartbeat is called one cardiac cycle. That means the cycle of events occur in one heartbeat is called as one cardiac cycle. In one cardiac cycle, it is consists of some repeated contraction and relaxation. Contraction also you can call as systole. Okay, and relaxation also called as diastole. Also this can be called as depolarization. Contraction or depolarization or systole, the same meaning is same. So in cardiac cycle part, this sequence occurs, contraction and relaxation. And this one cardiac cycle that occurred within 0.8 second. That means for one heartbeat, the events which occur where in one cardiac cycle that required 0.8 second. And in that time, it can pump 70 ml of blood, which is. Now I am going to draw a very rough diagram of heart. Okay. So already we discussed heart containing 4 chambers. This is called as right atrium. This is called as right ventricle. This is left atrium, and this part is left ventricle. Already I discussed in my previous lecture. Okay. Here in the right atrium, it containing this one is inferior vena cava. That one is called superior vena cava. Another one is there. Already I discussed this function of superior vena cava and inferior vena cava. Now another one, third part is there, that is called as coronary sinus. Coronary sinus carry the blood, deoxygenated blood from heart, and another is superior and inferior vena cava that carry deoxygenated blood from whole body system. Okay, so all this bloods are come first to the right atrium, and here between right atrium and right ventricle, here the valve is present. That valve is called as tricuspid valve. one valve is present, that valve is called as tricuspid valve. Okay. Now here, after through tricuspid valve, where the blood is moved to right ventricle, and from right ventricle there is a move to, this is called as pulmonary artery. This is carry the deoxygenated blood to lungs. In the same way, here these are pulmonary vein which carry the oxygenated blood to the left atrium. Here bicuspid valve is present. Here bicuspid valve is present. Bicuspid valve is present, and through bicuspid valve, oxygenated blood come to left atrium to left ventricle, and from left ventricle, that is enter to where? To aorta. Okay, and these two valves are called as semilunar valves. These two valves are called as SL valve. That means this is called pulmonary valve and this is called as aortic valve. These are already discussed in my previous lectures. This is called as SL valve. Now, in 0.8 second, now I am going to divide the different types of events. So, one cardiac cycle that is occurring 0.8 second. Now I am going to divide that 0.8 second to tell in 5 events. Okay. The first is called as number 1, that is called as joint diastole. This is called as joint diastole. That is occur for 0.4 second. That is occur for 0.4 second. Then next event, atrial systole. That is occur for 0.1 second. Then number 3, ventricular systole. That is also occur for 0.3 second. Sorry. Then number 4, atrial diastole. That is occur for 0.7 second. And then ventricular diastole, that is occur for 0.5 second. These are the 5 sequence of event that is occur in 0.8 second. That means these 5 events require to pump 70 ml of blood, which is called as stop volume. Okay, now that's why at the beginning I told that there is a sequence of event of contraction and relaxation. That is, contraction means systole and relaxation means that is diastole. That's why you see diastole, systole, systole, diastole. Okay, now come to here. First one is joint diastole. Diastole means, that means it's relaxed condition. At the beginning, out of this 0.8 second, for 0.4 second, none of the chamber, none this left, right, or this atrium, okay, or this ventricle in a relaxed position. No contraction will be there. Okay, that is called as joint diastole. That means 4 chamber will be in a relax. That is one event. Out of this 5 event, that is first event, that is 4 chamber will be in a relaxed condition. Okay, and that is for 0.4 second. Now, next point, that is atrial systole. That means here atria contraction occur because systole means contraction, or we can call it depolarization. Okay, depolarization, contraction, or systole. So here contraction occur where? In the atrial part, which is in the right as well as in the left part. Okay, that is for 0.1 second. Now, after that, when contraction occurs, the blood will be moved from right atrium to the right ventricle, like that, from left atrium to left ventricle. Okay, what type of blood is coming? You can see in my previous lecture. So here, deoxygenated blood is moving to the right ventricle when atria contraction occurs. Here, from left atrium, oxygenated blood is coming to the left ventricle. Now, after that, ventricular systole. Ventricular systole means now these ventricles will be contraction occur. That means the right ventricle as well as in the left ventricle contraction occur, depolarization occur, and that is occur in the ventricular part for 0.3 second. Okay, now see why it is 0.7 second. You see, this atria part only work for 0.1 second. That is, it is contraction only for 0.1 second, because 0.4 second all chambers are in a relax, no contraction, relax. Okay, so atria only contraction for 0.1, so total time is 0.8. That's why atria diastole for 0.7. So diastole 0.7, systole 0.1, so 0.7 plus 0.1 equal to 0.8 second. That is for this atria, this part. Okay, now come to ventricle, this part. Now if you see joint diastole, okay, joint diastole for 0.4 second, and another, when atria is in contraction, that means in a systole condition, then ventricles is in a relaxed position. That means 0.4, that is relaxed, ventricle also relax, that atria also relax. And when atria is working, that means in a contraction, that is for 0.1 second, and for same time, for that 0.1 second, this ventricles also in a relaxed position. So this 0.4 plus this 0.1, that means when atria is in a contraction for 0.1 second, at the same time the ventricles are in a relaxed position. So 0.5 second ventricles are in a diastole. Diastole means what? In a relax. Relaxation means also called as diastole. So that's why 0.5. Understood? So now if you see diastole, ventricular diastole for 0.5 plus ventricular systole for 0.3. Now also it is also come 0.8 second. Okay, in that way 0.8 second can be divided into total 5 events.